So you got, yeah, well, I mean, they've been following this bursa for a while, right? You have just basically like a big cystic area underneath your skin that's almost become its own kind of joint. And I'm sure that Dr. Smith told you that, and they tried to scar it down, it didn't work, and now you got a couple holes going into it. And you know, the treatment for it is to get you off of it, as you know.
Yeah.
Well, let me tell you, there's a simple surgery that I can try and do to close it up, and that involves opening it up a little bit, okay?
Yeah.
Taking off pseudo-bursa, or the old scar tissue. I'm basically just making an a fresh new wound by taking off all that tissue. And I'll have to excise I'll just take out the sores that are here, debride out all of that capsule that's in there, and then close it up and see how it goes. If you lay on your belly for 3-4 weeks after that, we should be able to get it closed with just one slick little surgery. Now, that's no guarantee, and it may pop right open, and if it does, well then we're right back where we are right now.
Right.
So if you want, I'll give that a shot. If you want to keep doing the wound care, I'm fine with that too. I just, you know, I hate how time consuming it is, you know, to have to do this.
I just really I don't want to go under the knife anymore, and I've already done.
I appreciate that. I appreciate that. And I'm here for you, okay? So if you want me to keep an eye on this thing, I certainly will. Or if you just want to have whoever's keeping an eye on it, keep an eye on it, that's fine. And then just if things don't work out, come back and see me.
Okay.
Because what I see is something, a surface area about the size of an orange or a baseball that's undermined. And you just got two little holes, each one smaller than a dime, really. And that's not the issue. The issue is what's underneath. Those are just the tip of the iceberg. So, you know, how can we get your skin to stick down to the underlying tissues? And you know, we gotta get them to heal together. So the VAC can do that. There's a lady named Patty over at the Cancer Center who's a wound care nurse too, and they can refer you to her if you want a wound care nurse. Now my feeling is that what I like to do with these wounds is I like to stir them up. If we're not gonna be doing surgery, at the very least, what I'd like to do is scrape it a little bit to get to maybe spark some areas of sticking together.
Okay.
So if that's okay with you, I'm just going to debride you while you're here. It'll just take me a minute, shouldn't hurt you. And
okay.
It'll make you bleed a little bit for a day or two, but that's what I want. What I want is things to stick down, and that's what'll get you healed. So I think if it's called curetting the wound, if they curette the wound for you, you know, every week, every 2 weeks, that should keep things moving along.
Heal from the inside. I want all those bursa sacs to heal from the inside out.
Yeah, the bursas don't do that unless you stir them up. So I'm going to stir it up now. And as long as they keep it stirred up, it should help things to adhere. Because what we basically need to do is we can do it the slow way, which is just scrape it a little bit, and we need to create a new wound. Because an old chronic wound stays open. So we've got to change some parameter. The VAC is changing it a little bit, but I think just curetting the wound will also help and accelerate things. And it's certainly, you know, it's a pretty minor thing. It can't really hurt you anything.
Okay.
Okay. And I just have them do it, and I'll put it in my note. They know how to curette, so they can certainly take over for you.
You know, I think it would be wise if after a couple of months would come back and you check on it.
I'm happy to do that.
Because
It's totally up to you. I'm happy to see it, you know, every week too, and curette it. It's whatever you want to do. Well, I mean, but it's all confined to this cheek, right? So, you know, I open it up, I scar everything. That can be scarred, everything that I can get to, I would, you know, freshen up for it. But as it stands now, I'm just going to grab a curette, okay? We'll stir this wound up a little bit and see if we can't kick the tires and light the fires.
I was wondering, on a little bit different subject, can they use stem cells to grow skin?
Yes.
And like, could you take a part of my stem cells or some of my stem cells and grow skin and that you could put back there so that you wouldn't have to take a skin graft from from another part of my body?
Yes, but it's called cultured autograft. It's much more fragile than your own skin, so you don't want it. It wouldn't be good. We only use that when someone's burned so bad that we can't get skin from any other source because it's very flimsy and it really scars badly.
Oh.
So it's not a good option now, maybe, 4 or 5 years from now, 10, 20, who knows, it may be, but it's not a good option now.
Okay, thank you.
Sure, no problem, I'll get a curate, you want me to go ahead with that?
Yes.
Just curate it up, okay.
Thank
Alright.
you.
Sure, no problem.